5 because people are joining in the 11th hour. Yesterday, today people are joining, right? So we never expected it will go to 125 or so much. So we will try to accommodate everyone and the video will be given for those who have not attended. Now the most important part of the subject is what?
So can we have a live session? I have a patient with me.
Yes, we'll have it.
Okay.
So we'll go for the live session. May I know who's having a patient? Yeah. May I know your good name? Where are you from and your background?
Myself, Habib from Kerala.
Habib, okay.
So my wife is having neck pain. This area.
Can I? Where is the pain? Can I see the? Can we see the location? Can anyone put them on the broad cam so that everyone can see? And within 1 or 2 minutes, we revive the pain.
So this area she is having pain from the from neck to this shoulder backside.
I'm not able to. Can anyone focus the this one? What is your name?
Can you see her, sir?
It is Techno BF7. Your video is closed.
Join kar फटाफट. कल वाली link है, password है 1 2 3 4 5.
Can you see her, sir?
No, I cannot see.
You are both
Please
of you
zoom
are
the
sharing the
camera.
screen now.
No, I'm not able to see. Yeah. Can you please
You can see her
enlarge the
now.
camera? Can you focus the camera?
Yes, sir. Here.
Can everyone see?
This is the area she is having pain. She's this area. She is very difficult. She's having very difficulty in turning to both of the
Okay.
side.
Do you have needles with you?
Yes, sir. Yes, sir.
Okay. Put one needle here. See me on the opposite side. Be quick. Put me one needle here.
1 minute.
This is having cervical radiculopathy, Kumar. The pain radiating from cervical to the scapula of the shoulder.
Sir, which point, sir? Lingu, that point? Lingu?
Yeah. Dabai.
Which one? Left hand or right hand?
Opposite side.
Opposite side. Okay.
Be quick.
This point, right, sir? Can you see?
This, right? Then this. Then here, one. SI3. Yes. Yes.
Okay. First
Then
this
one here. And then 1 year.
Okay. Should I needle in that order or anywhere from anywhere I can start?
You
Shall I
start anywhere. Yeah,
Yes,
you start from Lingu Dabai and do 4 needling immediately. One, two,
SI3.
SI3.
Three.
Then this one. Then this one.
So that
Jongbai.
is triple hammer.
Huh? It is Jongbai, it is Tung.
Okay. Which is the fourth one?
This
Just
one,
about that. Okay.
this and this.
Okay. Is it visible properly?
Yeah, now rotate this needle for 1 minute. Just
Which one?
rotate something. This one, this needle, the last one.
Clockwise?
You just rotate like this.
Okay.
And one sometime for this one, SI3. Now check the pen. How much pain?
How much pain? She's telling pain has reduced a bit only.
How much?
At a percentage no ramp.
50%.
50%.
Yeah. Rotate this needle more. This one.
Second one, right?
Yeah, second one. Ask her to move her neck little like this.
Sir, I'm not able to see your video.
Ask her the needle face to move like this little. Just mobilize right, left, right, left.
Pain is there.
How much pain is there now?
Same is what she is telling.
How much pain is there? It is almost 70% reduced. You can check.
No, she's telling still that is.
There will be some pain.
She's
but
having
you
the pain.
see, yes, she will have some pain, but almost 70% has been reduced. Check.
Okay, sir. Should I turn the needle again? Testing
Yeah.
the needle. Is it?
What happened? Pain जो ऑफर दिया 30 minutes.
Around 10.
Now see how much pain she has. How much pain she is having?
Sorry. Percentage or
Yeah, she can move her neck easily. Stiffness is
Ah.
reduced.
What she's telling that earlier she was not able to rotate. Now she is
Now
able
she
to
is
rotate.
able
Still
to
pain
rotate.
is there.
That means 70% of the pain is reduced. Stiffness of the neck is gone. After 20 minutes before the keep the needle, before the class is end, we'll see 80 or 90% of the pain is reduced.
Okay, sir.
Don't remove the needles, right?
Okay. She's telling the pain is more here, the shoulder arm blade.
Now how much pain she is having there?
Endor pain into pain. I think she's telling this area pain still persists. Almost it is there.
There is a trigger point there. Just press that area. Just do it like this.
Here?
Yes.
From front side like this, right?
Yeah, like this. It's a trigger point.
Where the pain is there, right?
Yeah. Just press it like this. Little tight. Yeah. Now check. Now check.
She's telling pain is bit more relief.
How much relief? She can move her neck totally to this side. So pain is almost 75% reduced.
She's telling that when she's turning the head to the maximum this side, she is having pain when she is rotating the head.
Yeah. How much pain she is having now?
50% കുറഞ്ഞുണ്ടോ? 50%
More
pain
than
is there.
50%. Her stiffness is gone.
Stiffness is gone.
Yeah.
That is stiffness is almost gone actually.
Yeah. So you can say almost
Only the pain
70% is reduced. So after some time, we will check the pain, put the needle. After some time, we will see she will get more relief. But you can see instantly the pain is reduced by more than 50%, and the neck stiffness has gone by almost 90%.
Almost 90%. Yes.
He was having
Sir,
stiff neck.
Can we use this same point for all the stiff neck, or case by case
No.
it will be different?
Case by case it will be different. And then put one needle over here. 3 fingers from the wrist of the finger. Triple warmer, yeah. Put one more finger here. Yeah, pain will finish.
Sir, can you repeat that acupuncture points, please, sir?
I will explain. I will give you all these points. Don't worry.
Okay, sir. Thank you.
This is just to explain you that an unknown person whom I don't know is treating his wife, who is not even my patient, whether she can recover or not. From this point of view, we can find that she can recover. So here you can see the practical aspect of pain. Now, we'll be explaining about the reasons of pain. So there are two types of main classification of pain. The main classification of pain is, one is tissue injury, one is nerve injury. What it is called? Tissue injury, nerve injury, and psychological pain. There are three classifications. What are they? Tissue injury, involvement of the nerve, and psychological pain. Clear? Psychological pain includes phantom pain, because if your one limb is amputated and you still feel pain, this is called phantom pain. This is called psychological pain. Am I clear? Yeah. Now the 5 most common types of pain are acute pain, chronic pain, neuropathic pain, nociceptive pain, and radicular pain. NOCICCEPTIVE, nociceptive pain. Nociceptive pain can be classified as the pain which has occurred due to the injury in the tissue of the body. Damage in the, just right shortcut, damage in the tissue of the body. Non-inceptive pain. Radicular pain means when the spinal nerves get compressed. We all know this lady whom we were reporting is called cervical radiculopathy. So this is classified as radicular pain. So in all these 5 classification of pain, including acute, neuropathic, right? Chronic, we find that this pain is, the treatment for this type of pain is very useful and good recovery. So this dry needle based treatment helps in the recovery of the patient in a better way, in a better understanding, and most of the cases you will get immediate results. You could see the stiffness of the neck of this lady was subsided in less than 3 minutes. Because this is a patient of Kerala and I don't even know him. This is called what? Blind study. Whether this treatment is effective or non-effective. So we choose randomly one person in the group whom I don't even know. Do I know you? The one whom I treated? Do I know you?
No, sir. No, sir.
Do we ever met?
No, sir.
Did I ever see your wife? Pain?
No, this is
Did
the
I
first
manage
time.
your pain?
No, no.
No.
She is
So
seeing
that
you
means
for
what?
the
This is
first
a
time.
random person whom we don't even know, and he came with a cervical radiculopathy without pre-notice, without classification of the disease. We understand that this lady might have this pain because of radicular pain. This is called radiculopathy with spasm. So in this
Sir, it might
case,
have happened due to wrong posture of doing sleeping.
more likely the pain was radiating from year to year. So the first doubt of we come to nerve impeachment.
Is it due to wrong posture? Maybe.
Now, for example, you will see there are many types of different types of pain, especially in Parkinson's, progressive supranuclear palsy. The patients are in terminal stage. I'm working in a hospice type of organization where you see patients suffering from different diseases and they are in the last stage of the case. So in this type of disease, we overcome various critical cases and various situations in which people are in the last stage and about to die. So we believe that this type of treatment really helps the patient, and pain management and paralysis management can be done in a very effective way in the type of patient. Without using much drug, you can give a very peaceful life to the patient. And now you can see, no doubt it's a hectic job, but then you learn very beautiful things. In this due course, let us understand Tung acupuncture was learned much largely in war region because Master Tung participated in Second World War and he saw large number of patients were suffering from large number of bullet injuries. Even I have overcome many patients in Assam, especially I have worked with many surrendered terrorist armies who had bullet injuries because Assam is prone to terrorist areas. And even I have treated the chairman of ULFA. It's a very banned organization. It is just like a very big terrorist organization in past. So during that part, I came to know that there were bullet injuries and all, and painkillers were non-effective to this type of patients. But gradually, with the help of these dry needles infusions, patient has revived and left a better life. So it was a very good evidence. If you see in my Facebook, and if you go and see, you will get large number of evidences in which we have recovered this type of cases. Now we have understood that there are 5 classification of pain. acute neuropathic radicular no-initiative, that means tissue damage, and idiopathic cause. One more cause we should write, idiopathic cause. We do not know what is the cause. And one more reason is cancerous pain. It's called oncological pain. That is cancerous pain. So in all this classification of pain, acupuncture helps. Now one more classification is called neural disease pain, because patient is having neuro disease, means brain disease like Parkinson and all, and then he is having lot of pain in different types of body. One more pain is neuropathic. We already told you where the nervine seat of the patient is damaged, especially in CIDP cases. In CIDP cases, the myelin sheath of the nerve is damaged. And then what happens? Because the myelin sheath of the nerve is damaged, the patient has a lot of burning sensation. Sometimes he has loss of sensation. It is called sensory deficit. What are the two types of deficit we face? One is neural deficit, one is sensory deficit. Neural deficit means the absence of movement. The patient cannot walk. And sensory deficit means the patient sensation is absent. In both the above cases, you will find a good recovery. Now, in cases of axonal neural demyelinating neuropathy, it is a type of MND disease in which the demyelination of the nerve damages the muscles. And another type of cases also you will get where demyelination is there with myelopathy, cervical myelopathy. Here, there is no spondylitis pain. It is created because of spondylitis, but there is no spondylitic pain. Cervical radiculopathy has no spondylitic pain, but the disc has compressed the cord. Because long standing means the disc has compressed the cord for a long time, and because of the long standing portion, there is a two types of situation. What are the two types of situation? Two types of situation is called myelopathy and myelomalgia. What is called myelopathy and myelomalgia? Tangam, please mute your mic. Tangam, mute your mic. Yeah, it is called two situations. What are they? Myelopathy and myelomalgia. Once the cord becomes thinning, means the size of the cord becomes thin, it is called myelomalgia. And once there is swelling, the cord, cervical cord, the size becomes little swelling in the cord. It is called myelopathy. What it is called? Myelopathy. In these conditions, patient loses his ability to walk and absence of walking. So, in this type of cases, laminoplasty, laminectomy, spine fixation, these are the neurosurgeries which are done. What are the neurosurgeries done? Laminoplasty, decompression, and spine fixation. These are the surgeries done. But these surgeries do not grant the recovery of the lower limbs as well as the upper limbs. They only say that further damage may not be done. But in surgery also there is equal risk of losing both upper and lower limbs. So it is advised that cervical spondylitis has to be treated in a proper way. Now, the problem in TEN and tongue is that it is pain management. It is not what? The treatment. You have to be very careful. Like chiropractic techniques should be avoided in any patient of disc prolapse. Because if you see, if there is a disc which is coming out and compressing the nerve or the cord, then what will happen? And you do it like this, velocity thrust. What will happen? There are chances that the cord may be damaged. So before doing any chiropractic technique, osteopathic technique, you must be very careful about what? Very careful about osteopathic or chiropractic technique. Diagnostic method has to be carefully used to understand whether this method is applicable or non-applicable. I am not in any way criticizing any system, but I am just saying that you must apply your own intelligence to guide yourself, because if the disk is extruded or is compressing the cord, then you must be very careful while you use osteopathic, chiropractic, or any type of method. These methods of pain management are important because you have to build a rapport with the patient. And initially, patients are very afraid. Even in my clinic today, one patient came, I inserted just 1 or 2 needles. Then she said, oh, I'm having stiffness, or I am having this, or you give me one injection, what you will give? So certain types of such questions, they come. And in my opinion, do one counseling to the patient. If the patients do not understand the gravity of the situation, better to see of this type of patients. Because one thing we must understand, in 70% of the patient, the formation is 70% is psychological disease. These patients have lot of psychological questions which no one can answer. And 30% is the disease. So it is called psychological pain. What it is called? Psychological pain. For example, we call it hysteria. Many times in hospital, when I'm walking, I saw patients come with what? Saying this. And then I say, oh, I'll give you such a big injection. Automatically people become what? Okay. And then say, oh, I'm feeling better. Oh, no, I'm going to give you big saline. Oh, what happened? Oh, I'm feeling better. Oh, do I need to give you injection? No. In many of these hospitals, I just give normal saline to the patient as injection, and they say, I'm feeling better. See, the one thing you must understand, counseling of the patient is called psychological counseling as well as the treatment. The most important part of the treatment is counseling of the patient. If the counseling is proper, then 50% of the disease is done. Then it helps you to build the rapport with the patient. And then you can apply your own methods. TAN, TUM, and TCM methods are very important methods. We'll classify this class into 3 methods: TCM method, TAN method, TUM method, and then I will try to give some videos in Facebook, which you can see how I treat the patient. It will be very difficult from this small, what you call, laptop video to guide. But anyway, you may bring some patients. After 9 o'clock, we can have some patients to be treated, so that you can understand. Now, for example, the method which we applied was TUM method. So now we can understand that the disease has many manifestations. And one thing what I have to repeat here is that you must understand pain is a symptom or pain is a disease. So without diagnosis, pain is a symptom. After diagnosis, pain becomes a part of the disease. Right? For example, I am having a stomach pain. So I may give what Buscopan or any other injection or PC6, ST36, SP9. Certain points are there. Patient may get immediate relief. But after some time, the pain may reoccur. So at that time, we advise the patient to go for ultrasonography or CT scan abdomen. Sometimes we advise the people to go for contrast study, and triphasic study means all the 3 diagonal of the abdomen has to be studied. Then we find that the patient may have gallbladder stone, right? He may have cancerous problem. He may have GB cancer, gallbladder cancer. Like Mohan Patedar was speaking, the patient whom he referred me was primarily having gallbladder cancer, GB cancer. And we have managed it very well, the JB cancerous pain with this type of treatment. So we can understand that pain management is a very good source, and without any side effect, we can recover lot of patients with simple formulas. Initially, I'll give you a lot of protocols, right? Initially, what I will give? Lot of treatment protocols. So when you forget, I'll give you my website, mksastry.com. Please write down the website, mksastry.com. In this, the number of the point and location of the point is given. You don't need to buy any software. You don't need to buy anything, because there are large number of protocols as per my experience I have given in tongue acupuncture. And then I will also give you certain advanced techniques of balance method in neurofibromyalgia and all, so that we can understand patient can recover in a better way without any side effects. Right. The most important part of learning this technique is that we can avoid non-steroidal anti-inflammatory drugs and other medicines, so that the patients do not lose their kidney or liver. Because putting these salts regularly in this patient may result to damage of kidney, damage of liver. I'm working in this hospital, Sastry Neuro Rehab Hospital, where we get most difficult cases, near death cases we are managing, terminal disease cases. So if the people say in terminal end of the disease also acupuncture do not work, it is not like that. In the case of my mother, I have applied our acupuncture and dry needling procedures, nerve stimulation and brain stimulation in the last stage of our disease, and it has worked very well. This spondylitic changes means what? Spondylitic changes means there is an inflammation in the spine. Now, there are several types of degenerative changes in the spine. Lordosis is the shape of the spine. If the curvature of the spine changes, we call it and it becomes straightened. There is a shape of the spine. If that space of the spine is changed and it becomes straightened, we call it what? Straightening of the spine of the lordosis is lost. When the original shape of the spine is lost because of your body activities, because of your body postures, right? We call this lordosis is lost.
हाँ, ये नहीं ऑफ कर दिया आवाज से।
Sir, what happened?
we find multi-antibiotic resistancy. So in these cases also, this helps to what? Revive the patient, and it helps to, in a great extent, it helps the recovery of the patient. In meanwhile, I will also show you that I have been eating some sweets near you, and my sugar, which was 600, after eating sweets, and before we close the session, I will show you by the blood glucometer that my sugar is under what? Control. So all this can be achieved. I have not used any of the herbal medicines by Radhesham or anything. I just maintained what? Food is thy medicine. And after that, I have tried to take the snacks, all these things I am taking. I am not having any difficulty in digestion and all. And I have seen that my gut, which was having hyperacidity, has come to a good control. I have taken this samosas. I have eaten today 2-3 samosas to check out whether I am having hyperacidity or not. You can see I am not having any hyperacidity. I am not having any bumpering. I am not having any indigestion. So the most important part of our life is what? That we must maintain a balanced diet, number one. Number two, food is the medicine, because many food creates inflammation of the disease. Like in hyperactivity disorder, artificial sugar, write down. The most important thing which creates problem is the artificial sugar. What is artificial sugar? Horlicks, malto, Bornvita, they contain 70% of the sugar. They are not health drinks. Health drinks can be made by the mother itself. Whatever you can make in the kitchen. Kitchen is the best pharmacy of the world. All the best doctors are in the kitchen, I say. All the ladies, old ladies are the best. What? Because I remember when I used to have stomach pain in my childhood, my grandmother used to give something like this, and I used to drink, and my health was okay. My grandmother was deeply against Horlicks, Bornvita, and all these things. So now we understand that if we follow these advices of our elders, and if you follow these symptoms, and if you follow good process of treatment, then we can understand recovery of a patient is very easy. Patient will not go under complication. Three things we must understand: classification of pain, diagnosis of pain, and then the selection of the procedure of the treatment of pain. Sometimes it is surgical, sometimes it can be managed non-surgically. So, selection, what are the three things we have to understand? Classification of the pain, what kind of pain it is, which is told by the history of the patient. It is called classification of the pain. Then history of the pain and diagnosis of the pain. We have to diagnose what kind is the reason of the pain and the methodology for the treatment of the pain. Am I clear to all of you?
Sir.
Yes, Prakash ji.
सर थोड़ा हिंदी में भी शॉर्ट में रिपीट कर दो.
हाँ, मैं 9 बजे के बाद हिंदी में बताऊंगा.
राइट सर, थैंक यू वेरी मच.
मैं शॉर्टकट में अभी हिंदी में बताऊंगा.
यही सब बात बताना है.
हाँ, right. Just give me 5 more minutes so that I explain in English, and then I'll explain things in Hindi. Now I put myself to you to ask your questions, please. The question hour starts. Those who want to ask in English, they may ask me in English. Those who want to ask me in Hindi, they may ask me in Hindi. But before I go, I will just speak 5 minutes in Hindi so that those who are the followers of Hindi, they can understand. पेन के कुछ क्लासिफिकेशन होते हैं. पेन के 5 क्लासिफिकेशन होते हैं. सबसे पहला होता है एक्यूट, जो अभी हुआ है, थोड़े दिन पहले हुआ है, 1-2 महीने पहले, एक्यूट पेन बोलते हैं. उसके बाद होता है क्रोनिक पेन, जो 6 महीने से ज्यादा हो चुका होता है. रेडिकुलर पेन, यानी यहाँ गर्दन में दर्द होता है, गर्दन की नस में दबाव होने के कारण हाथों में दर्द आना, कमर में दबाव होने के कारण पैरों में दर्द आना, उसे न्यूरोपैथिक पेन बोलते हैं. इसमें जलन और नमनेस मतलब आपको महसूस नहीं होता, सेंसेशन कम हो जाता है. ठीक है. 5वां होता है इडियोपैथिक पेन. इडियोपैथिक मतलब इसका कोई कारण नहीं है. वी डू नॉट नो द रीजन ऑफ द पेन. इसका किसी कारण का पेन नहीं होता. और छठा होता है कैंसरस पेन. कैंसर के कारण दर्द होता है. राइट. अब इसमें 3 मुख्य बातें होती है. मेन क्लासिफिकेशन ऑफ द पेन, पेन किस तरह से हुआ है, क्यों हुआ है उसकी डायग्नोसिस यानी उसका किस कारण से ये पेन हुआ है, एक उसका कारण जानना होता है, और चौथा रीजन होता है कि अब हम उसको किस तरह से ट्रीट करें, सर्जिकली, पोस्ट सर्जिकली क्या करना है, प्री सर्जिकली क्या करना है, और वो कौन से स्टेज में वो डिजीज है जिसका हम पेन का मैनेज कर सकते हैं। फॉर एग्जांपल सर्जरी के बाद भी बहुत सीवियर पेन होता है, उसको भी हम इसके द्वारा मैनेज किया जा सकता है। सारांश में यही एक मोटी बातें हैं जो हमको समझना है, और सबसे अच्छी इंपॉर्टेंट बात यह है कि इसका कोई साइड इफेक्ट नहीं है, इंस्टेंट रिलीफ है, रिकवरी है, और आप चाह सकते हैं तो you can get a very beautiful understanding about this subject with more book, more classification, and within 1 or 2 days the participant will increase to 300. So if anyone wants to join, they can join the class. We'll go with 1 or 2 more introductory class because I understand आपका knowledge इस subject में limited है. Not only आपका knowledge limited है, even we have seen that neurosurgeons, orthopedic surgeons का भी नॉलेज बहुत लिमिटेड होता है इन पेन मैनेजमेंट, क्योंकि वो पेन किलर पर भरोसा रखते हैं. हाउ टू ट्रीट द पेन, समटाइम्स दे आल्सो कैन नॉट अफेक्ट विद हायर पेन किलर्स. यहाँ भी हम लोगों ने देखा है, मेरे साथ कार्डियक एनेस्थेसियोलॉजिस्ट काम करते हैं एज माय सीनियर इन दिस हॉस्पिटल. तो हम लोगों ने देखा है कि कितनी बार ये पेन किलर्स, हायर पेन किलर्स लाइक कैट्रोल और ब्रुपुजेसिक काम नहीं करती, वहां ये नीडलिंग फटाफट काम करके रिवाइव कर देती. अभी एक पेशेंट है वास्कुलर नेक्रोसिस, राइट. 1 मिनट पहले जब आपकी क्लास चालू हुई थी, मैं उसके रूम में था, सीवियर वर्टाइगो. मैंने 3-4 नीडल यहाँ मारी, उनका वर्टाइगो खत्म हो गया, इंस्टेंटली रिवाइव हो गया. तो ऐसा नहीं है कि ये बहुत समय लेता ठीक करने में, सिम्टम्स को ये इमीडिएटली एलोपैथिक मेडिसिन की तरह सबसाइड करता है. तो आप अपने पेशेंटों को भी बता सकते हैं कि आप यहाँ इसको ऐसे दबा लीजिए, इसको ऐसे कर लीजिए, यूं कर लीजिए. तो आप लोग बहुत कुछ सिखा सकते हैं अपने अपने तरीके से, सो दैट वो बार बार परेशान नहीं हो, बार बार पेन किलर्स नहीं लेना पड़े. जिनको सूजों का था वो मैग्नेट यूज करे, जिनको एक्यूपंक्चर आता वो नीडल यूज करे. Am I clear to all of you? Those who are in Hindi and those who are in English, you may ask me questions in English. Those who are in Hindi, they may ask me questions in Hindi. Please follow.
सर
डॉक्टर
हाँ प्रकाश जी.
सर 1 मिनट, मैं ये कहना चाहता था कि अगर आप हिंदी में स्टार्ट कर रहे हैं तो इंग्लिश में जो लोग हैं अब हिंदी में ही चलाना है, तो उसको बोलो लीव करे ताकि जो नए लोग हिंदी वाले जुड़ सके. कई लोग वेटिंग में हैं, देख लो.
नहीं वो कोई बात नहीं, अभी तो 300 तक आ जाएगा. हम लोगों ने ईमेल दिया, कुछ प्रॉब्लम आया, उन्होंने रिप्लाई दिया है. देयर इज सम टेक्निकल प्रॉब्लम इन दिस वन फॉर अपग्रेडिंग. इसको अपग्रेड बोलते हैं. हम लोगों ने 100 लोगों का लिया था, अपग्रेड करने में उनको कुछ प्रॉब्लम आ रहा है, टेक्निकल प्रॉब्लम आ रहा है, वो टीम सॉल्व करते हैं, इसको अपग्रेड कर देंगे. यानी 1-2 दिन में वो लोग अपग्रेड कर देंगे.
यही हिंदी, ये भी इंग्लिश में बता दो सबको जो इंग्लिश जानते बोलो.
So we have written an email to Zoom to upgrade it to 300 people. So until it is upgraded, we'll go with this introductory classes. But this introductory class is very useful because we'll be giving you a number of protocols to understand various pathies of pain, various knowledge of pain, and then we can understand how recovery of pain can be done.
Doctor,
So
I have a question. Yeah.
Yeah,
Thank you
please
for
tell your name. Because
Yeah,
there are
Bidun-
more than
this
100
is-
people, it will be difficult for
Yeah.
me to understand.
Yeah, this is Bidun from Kerala. Thank you for the great session, Doctor. And you started with a live session. Very thankful for that insight on a practical session. And regarding that terminology, Doctor, some of the terms I couldn't take it properly. If you could have that slide with you, can you quickly show us the slide so that to get the terminology proper?
This type of slides are I'll make and I'll give in the group, right?
Okay. Okay. And in the type of pain, the fifth one is after the radicular. What is this nociceptive? I write it like
Yeah,
that.
it is a tissue injury pain.
Tissue
Injury. The
Tissue.
tissues of the body are injured.
Okay. Another question. In the two types of situation, one is myelopathy, and the second one I couldn't get it properly.
Myelomyalgia, myelopathy, and myelomyalgia.
Myelomyalgia spelling. How to spell?
You can check in Google. MY.
Okay. Myelo.
Bidun, I will
Yeah.
give you a simple example. You came with one fat lady, na? With me?
Yes. Yeah.
Yeah. If the cervical cord is like you, thin, it is called myelomalacia. If it becomes like a fat lady, it becomes myelopathy.
Okay.
And it is because of the long-standing compression. It leads to paralysis.
For thin people, myelomalacia, right?
Not for thin people. It is called the thinning of the cord.
Thinning of the cord. Okay.
Cervical myelopathy is the thinning of the myelomalacia is the thinning of the cord because of long-standing compression. The disc is compressing or the bone is compressing the canal. As a result, the cord inside the canal gets compressed. If it is for a long time and your lifestyle is not corrected, it becomes myelomalacia or myelopathy. In both the conditions, you may lead to paraplegia or quadriplegia.
Okay, doctor. Thank you. And another question, the last question. This master Tunga acupuncture, how when we select when we select that application, irrespective of compared to the acupuncture.
Master tongue acupuncture is very good. Is one of the very good methodology for relief of the pain. It does not recover many times it does not recover the cause of the pain, but in many types such points are very helpful in recovery of Parkinson's. Along with Biswas, I'll give you a complete slide on different types of sciatica pain in the group. Don't worry.
So master tongue, it's all this kind of Parkinson's and kind of
See, many types of disease it helps as an adjuvant. In many times you get immediate pain relief, but it does not recover the diseases in many cases. And it cannot recover myelopathy, it cannot recover myelomalacia. Even after surgery, this situation cannot be recovered. So gradual rehabilitation with proper process can recover a good patient.
Okay, doctor. And what about this balance method in pain management? Dan's balance method.
See, this balance method was taken from I Ching acupuncture, which was for a very long time.
That also applicable, right? If we know that for pain management.
Yeah, it is also, we will teach you pain management. We'll try to teach you both the methods. We'll give you direct points because going in deep will be not possible. And after that also we'll continue the class. After
Okay,
6 days, 7 days, we'll continue the class 1 hour every day so that we can have detailed discussion on various types of classification of diseases, pain, reading of MRIs and everything, right?
Thank you so much, doctor. So I expect all the day you will be showing a live session like a case study you did today, first session. Thank you so much. Thank you.
Yes. Thank you so much. Yes,
Thank you, doctor. Good night.
Patekar sir, any question?
No, nothing. I just am saying good night, doctor.
Oh, you're leaving now?
Thank you very much, sir.
Yes. One Mr. Deepak Fan Hale. Yes, sir. Please ask your question. You are raising your hand. Deepak Fan Hale.
Okay, thank you so much, doctor. I'm Kamso Chukwu from Nigeria. Sir, you said some patients suffer from psychological pain. So my question is, how can those patients with psychological pain be handled? What can be done?
The psychological pain can be removed with
Sir?
With different methodologies, especially in PTSD, we call post-traumatic stress disorder. This type of pain conditions especially occur in those people who go through a trauma conditions, right? They don't have this pain, but they gradually continue to feel this pain. For example, I saw one patient in Assam who continued his treatment for back pain, whether there was no treatment was required. We tested him everywhere, there was no pain, but at night they will trouble her husband, and her husband said, "Sir, please treat my wife. I have no other option. If you don't treat, my home will become a hell." I said, "She does not need any treatment. Sir, you need money now. You put your needle wherever you want. So sometimes I used to give a placebo needle. And the husband said, sir, for your placebo, so you take money. I have no problem. Because of these needles, I have peace in my house. So this type of pain is called traumatic pain. So NADA protocol is there. Some protocols are there, which we will show you. These protocols will help you to recover what?
ये बात का भी हिंदी कर दो सर,
PTSD.
मजा आएगा।
PTSD यानी पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर, यानी दर्द नहीं है फिर भी आप दर्द 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 करते रहते हो. We have seen many patients like this who have continued 9 months, 10 months because they have a fear, and we also get tired and we also say them, okay, you continue.
Doctor, my name is Nelson from Nigeria. Some of the questions in India, can you explain them in English? Probably.
I have already explained them
the
in English. I just translated them in Hindi for us.
No, I mean the question. Translate the question in English so let's understand the question while you answer as well.
Yeah. Okay, I will translate them in English also, and I'll give both Hindi and English explanation to what they have asked. This person was asking me about the post-traumatic stress disorder, means psychological pain, so which your Nigerian friend has asked. So the other person said me, can you elaborate this? I said that yes, you can elaborate in this condition, that the patient continues the treatment without having pain. So I explained them one case of my life in which the patient wife was totally recovered. Clinically, there is no pain, but she continued her treatment. And the husband said, sir, you continue. And most of the time I used to give a placebo, means I used to prick a needle anywhere, and she had no pain in her life. That means what? It is PTSD, post-traumatic stress disorder. Because people go in war, so they see many people dying, many things happen in the war. That psychological feeling they carry with them, and this results to what? Pain. Especially in paralysis patients, even in these conditions, we find a lot of, especially in central pontine myelinosis, CPM. It is a hindbrain myelinosis which is because of the low sodium. When the sodium becomes low inside the body, patient goes to a coma stage, and then it has to be corrected gradually. Otherwise, the patient do not come out from the coma stage. And then we find that once the patient comes out from the coma stage, right from beginning, you have to teach him. And then he behaves like a small child. Every time you will say, I have this pain, that pain, will never cooperate for physiotherapy. In this process, acupuncture, your soft spokenness, and your cooperation with the patient helps you to recover such a patient. I'll post you this video tomorrow or day after tomorrow about a very critical patient who was almost in a coma stage, whose total body is spastic, and we are making him to walk again with support. He is able to speak, but he was once in a Glasgow coma scale 3. That means he has survived death, and he has been recovered to almost 50 to 60%. GCS wise, he is very good. Eye response, voice, everything is good. Only we are making him to walk, because in such patients, you have to teach them how to see also, right and left, how to move the pupil also. That part also has to be taught. So this type of patients, it takes time to recover. But in many coma patients, many types of patients, we have done very successful recovery from very vegetative stage to a good stage of recovery we have done. No doubt we are successful, we are unsuccessful. Even the best hospital like Medicover Hospital of Hyderabad, Apollo hospitals, they are also doing the same thing. They revive the patient and they send it to a different center for recovery. So it is not like that one is superior hospitals are the end, and smaller hospitals like us cannot sustain the patient. We also help to a great extent for the recovery of the patient. And it is most important part that this acupuncture, dry needling, integrative method, regenerative method has helped the patient to recover to a great extent. Total knee replacement up to grade 3 also can be supported with regenerative. Pain can be subsided. Lot of things can be done, only provided what? You have that knowledge and expertise to do it. And it will come in a gradual time. Continue practice, continue seeing YouTube videos, continue your knowledge, improve your knowledge, and I'm sure you will be able to do a lot of things. MK Sastry method is a what integration of various methods. It is my own experience, which we have learned through CT guided procedures. Because in CT we have thought that how to reach the nerve roots without injuring, whether injury, how deep it is. So we have taken the photos after inserting the dry needles. So we found that inserting 5 tube needles from here may cause a pneumothorax. But we inserted it safely, so only little part of the lung was injured, which was healed in a way. So all these things we took the risk and we have learned it. But my advice is that up to a certain level you can please manage, and when you are not able to manage, it is also said it is better that we refer it to a higher center. We also do the same thing. We refer to the patient to a higher center. Thereafter the patient comes back and we try to manage it. Up to a level we can manage, up to certain level we cannot manage, and then again we try to remanage the patient. Clear?
Doctor, on sincere suggestion from my side, for the first 1 hour, 8 to 9, only in English, and rest 9 to 10, please do in Hindi, so that everybody can watch it,
Yeah, from 8 to 9 we are saying already. I told you 8 to 9.
Sir, this is very good suggestion, sir.
8 to 9 will speak in English. From 9, those who are English speaking, they may leave or they may stay, no problem. I'll translate them from English to Hindi also, and Hindi to English also. But from 8 to 9 we'll continue with English. From 9 to 9:30 and all, we'll speak in both the languages, right?
Very good, very good.
All your suggestions, all your things are welcome. I'm not rigid for anything. What is my problem? I am a single man without wife, without mother, without father, without brother, without sister. So when I am getting an opportunity to speak to you, my stress of the day is also released.
Sir, we are all your brothers and sisters, and we all are your family.
Everyone is there, but in this room I am alone. After 1 hour I am alone.
कोई नहीं सर, आपको शादी करनी है तो व्यवस्था हो सकती है.
नहीं साहब, अब तो संन्यास ले लिया, अब तो शादी का कोई मतलब नहीं. I have to attend a monk.
तो मैं ट्राई करता
हूं.
The
rest of my life I will like to spend in my research management and improve the technique, so that my today is given for your tomorrow. My books which I have written after my death, because I'm not giving these books immediately now, because many controversies are there in this book. Immediately court cases, litigations will come to my head. So after my death, so I am establishing so many groups, so that all these books are given to you free of cost, and then no one can stop. Because I am dead, no one can stop the distribution of the books, because it is not required for publication. I have given up free of cost. I'm not giving you this book because right now there are many things which I have observed and which are not in favor of present situation. And if it comes in the market, it will have a lot of legal litigation. Legal litigation means बहुत सारा court case हो सकता है, and for that reason मैं ये किताबें बाजार में नहीं दे रहा. Means I am not giving this book in the market. See, most important thing why I don't like to marry is that I want to give my 100% time. Almost I have closed half of my life. Only little part of my life is left. So in this part of life, I like to dedicate more and more to my work, so that people can sustain, because my whole family has been finished because of the side effect of medicines, because of various problems. So I wish that you all have a happy family.
Hyderabad, but he is doing this fellow.
So
he's lot of
my thing is that till we are alive, let us do whatever we can. And after all, we are supposed to die one day. And let us die with a piece of our inner self.
But with acupuncture, he's treating so nicely with the pains. Needed, he is doing surgery. Otherwise, he is doing stem cell therapy.
So you may ask any more questions you have. Ratan Lal ji, you have a question?
हाँ सर, प्रणाम सर।
आप तो बिल्कुल वृद्ध व्यक्ति लग रहे हैं, अब तो दादाजी लग रहे हैं। कहाँ 5-6 साल में तो आप क्या जवान थे, क्या हसीना थी आपकी। मैं तो सोच रहा था फिर जब शादी हो जाएगी, अब तो आप 60-70 साल के लगने लग गए। क्या बात है, अब तो बुजुर्ग लगने लग गए।
हाँ सर, उम्र भी तो अब 69 हो गई सर।
क्या 69 हो गई रतन जी?
या सर,
क्या बोल रहे हैं? दिल्ली में मिले थे तब कितनी थी? रतन लाल जी, दिल्ली में जब मिले
हाँ
थे
सर।
तब कितनी थी?
हाँ सर, ये जो साइटिका डेवलप हो रहा है आजकल, तो साथ साथ में साइमल्टेनियसली सर्वाइकल और हैंड तक जा रहा है।
नहीं, सी एक बात बताते, सर्वाइकल, ही इज आस्किंग मी अबाउट सर्वाइकल radiculopathy and lumbar radiculopathy. Means the pain which comes from the lumbar area and cervical area. This is his question. I reply it in Hindi, then I'll translate it in English. Cervical और lumbar किस कहीं से कहीं नहीं जाता था। सर्वाइकल एरिया यहाँ से हाथ तक आता, लुम्बर का पेन कमर से पैरों तक जाता है। इन दोनों का आपस में कोई वो नहीं है, बट बेसिक रीजन ये है कि स्पाइन धीरे धीरे वीक हो चुका है। ये उम्र के साथ भी वीक हो सकता है और किसी और कारण से भी वीक हो सकता है। तो इसमें मेन कंपोनेंट होता है विटामिन डी, आपको देना जरूरी होता है। मैग्नीशियम और कैल्शियम का कॉम्बिनेशन जो न्यूट्रिएंट सप्लीमेंट्स है वो देना कंपल्सरी होता है। लाइफस्टाइल करेक्शन जरूरी होता है। एंड देन अकॉर्डिंग टू द डिजीज क्या प्रॉब्लम है, एक्सरे और वो देख के। इस उम्र में सर्जरी करना तो पॉसिबल नहीं है, सर्जरी इज नॉट पॉसिबल, सो वी हैव टू गो फॉर व्हाट, दिस टाइप ऑफ पैलिएटिव केयर ट्रीटमेंट व्हिच मे हेल्प द पेशेंट टू ए ग्रेटर एक्सटेंट।
धन्यवाद सर, धन्यवाद धन्यवाद।
आप वही रतन लाल जी है ना जो दिल्ली आए थे मेरे पास?
हाँ सर,
ना दूसरे हैं जो
वही
ओसो
है सर,
मालवी
वही है।
है?
अरे वही है सर।
आप तो बिल्कुल ही बदल गए। हाँ, आप तो बिल्कुल ही बदल गए, अब तो पहचान में नहीं आता। बेटा क्या कर रहा है अब?
ये बेटा तो संगीतकार बन गए हैं, शास्त्रीय गायन के।
और जिसको दर्द हो रहा था, साइटी का कुछ प्रॉब्लम था, वो कहाँ है अभी? पेट का जिसको
वही तो है।
प्रॉब्लम था?
यहीं पे है सर, दिखाऊं उसको सर?
ठीक है, देख लेंगे। अरे वाह, ये तो बहुत बड़ा हो गया। प्रणाम बेटा, वेरी गुड, बहुत बड़े हो गए अब तो लगता ही नहीं कोई बीमारी है। वेरी गुड, यस, रिकवर्ड वेरी नाइसली, बहुत बढ़िया हो गया।
आप ही की कृपा है सर, आपकी कृपा है, आपकी कृपा है सर।
और आपका कैसा
आपकी
चल रहा है?
कृपा
आपकी
से स्वस्थ
मैडम
हो गया।
कैसी है? मैडम तो कॉलेज में स्कूल में नौकरी करती थी, रिटायर्ड हो गई ना, अब ये है
अभी हैं सर, अभी अगले साल रिटायर्ड हो रही हैं।
बाड़मेर में ना?
आप ना, आप अब जल्दी आइए।
बाड़मेर में
आ
ही
रही
है ना?
अब बाद में, अब आ गई सर आपसे मिलने के लिए।
वेरी गुड। These are all my old students. I have
प्रणाम
taught
सर।
them around 6 years
सर
back.
प्रणाम।
Namaskar. Now
प्रणाम
you can see my
सर।
memory is very good. I still
सर प्रणाम।
remember them, everything. I have seen their child who was having GI problem.
यस, परफेक्ट।
आप तो बिल्कुल बदल गए, आपके तो बीच में सफेद
यस
चूल
सर,
आ,
यस सर। थैंक यू
आप लोग तो
सर।
6-7 साल में तो पूरे पूरे ही बदल गए। कभी हम भी जवान हुआ
तो सर
करते
एज
थे।
भी तो कितनी हो गई ना।
5 साल में एज कहाँ बदली होती है? अब तो 5-6 साल
हम
पुरानी बात
आपको
है। दिल्ली
हमेशा,
में तो दिल्ली
हाँ
में तो
दिल्ली
6
में भी
साल
मिले
पहले
थे ना
मिले
हम
थे।
सर।
हाँ, दिल्ली में तो 6
हाँ
साल
दिल्ली में
पहले
भी
मिले
तो।
थे, 6 साल में बुढ़ापा आ गया।
ठीक है, थैंक यू
Very
सर,
good.
थैंक यू सर।
प्रणाम सर, प्रणाम
See,
सर,
Vidum,
प्रणाम।
this is I'm just interacting with my people. They were I treated that GI problem 6 years back. Their son was there. They came to my seminar 6 years back. Now the child is not having any such problem. They are my old students, which I met them 7 or 8 years back. I said that they have become old. At that time, they were very young. They used to look very young. Now they are around 69 years. They are still practicing around 70 years. And I know them when they were 60 years. I've been in teaching line more than 15 years. 15 to 20 years I've been in teaching line. They are my old student, 10 years old student. And Deepak, you have any question for me?
Sir, what type of the diagnosis we are using?
The diagnosis, we are using modern diagnostic method because we cannot, because the complication of the disease do not follow us with the normal methods. Because patient may have any type of disease, we go with the symptoms and then we advise him to go for the what?
सर हम
For example, the
डायग्नोसिस का
patient
क्लास
came with
डायग्नोसिस का
बस
क्लास ही रखेंगे ना अलग
हाँ
वेबिनार
वो diagnosis के class पे रखें. We will keep a separate class for modern diagnosis. We'll teach you different MRIs, CT scans, and different methods. And most important part we will teach you is about different methodologies of the diagnostic. So the person who was asking me, I don't go for I integrate the traditional diagnosis, but for medical substantial, we have to give medical proof of the disease. We must have documentary evidence of the disease. We cannot follow always the clinical symptoms like tongue diagnosis. All these types of diagnosis may be a clinical symptoms, but they are not definite. So in this practice, we must have definite symptoms with definite documentation and definite reasons of the disease. Otherwise, there may be a clinical litigation. Litigation means you may go under medical negligence. More questions?
Hello, doctor. I am Vijaya.
Vijaya, please tell me.
I'm from Pune, doctor.
I know Vijaya, we met yesterday. Please tell me.
I am an acupuncturist.
Yes, madam. You told me yesterday.
Okay. And is it, are you teaching tongue
Yes,
method?
madam. We are teaching tongue and 10 method also. We'll give you a lot of protocols, but we are only that we want to increase the member to 300 because some members are not associated. And many people do not have a background of understanding pain management and many things, right? So that they have little background of technical terminologies, little understanding. Let me also take some time to understand various backgrounds because people are coming here with various backgrounds. They are not medical doctors, right?
Yes.
So it will be, I have to come much level down. So every time when I speak, I understand that from where I have to start, what I have to give. And then I understood that I'll give you various videos through Facebook and I'll post it so that what will happen? You can understand what?
Thank you. Yeah, we can.
You can understand various tongue method. I'll explain the tongue method through Facebook videos of the giving protocols.
These 6 days it's a till 6 to 10th of February.
Pardon me, madam?
This webinar is going on only 6 to 10th of February, right?
No, madam. We will increase the time also. Knowledge group, everything is going to increase. It is just giving a time limit so that many people make a hue and crowd, right?
Okay.
So after certification also, the class will continue. Many things will be continued. Nothing is going to stop.
Thank you so much. Thank you so much.
Money cannot buy knowledge, and the knowledge is infinite. The more we go inside, the more we will understand.
Yeah, sure. Thank you so much. Thank you.
So if you have any typical patient, critical patients whom you are not able to treat, you may refer it to us, and we will try to help that patients. To see what kind of patients have recovered, you can go to MK Sastry Facebook, and I hope you can understand the recovery of the patient is better. And thereafter, you can do the further follow-up for the full recovery of the patient. Let us bring the patient to some good recovery, so that you can make the patient more better, and your name may also sign that you have recovered this type of patient. Right?
Sure. Thank you so much. I'll go. What is your email?
MK Shastry. SASTRY. I'll give my Facebook ID in the this WhatsApp group.
Okay. Thank you, sir. Thank you, doctor. Thank you.
Thank you, madam. Thank you so much.
Okay.
Any more questions, please? Yes, madam. Please tell me.
Sir, you said in the beginning that you have eaten sweets and your sugar's gone high and you're going to check it. I was very much interested. My mind is just wandering around that. So I would like to
So
try it on
earlier my
myself.
sugar was around 600, 500. And then it was very difficult for me to manage. I thought to go with insulin. But then suddenly I came to know about the various processes of recovering my own self. Now I take ice cream also. I'll eat ice cream near you. I'll eat dates. I'll eat many things near you. And then after 1 hour, I'll show you my sugar is 120.
Oh, that is wonderful. It's such a good news because I've been struggling with alternative treatments for so many years and none of them gave me any good results. But the present one is better what I'm doing, which I told you about yesterday. But this is something I would really like to try on myself. And I don't know
Very
about
simple
anything about
method I will tell you to recovery of blood sugar is take deep inhale, stop, and slowly exhale out. You do it for 20 minutes and then you check your blood sugar. It is reduced to multifold. Because stress imposes sugar, diet restriction, gut healing, and breathing recovers diabetes in a very beautiful.
Yes. So
deep breathing exercises are very beautiful, recovering large number of diseases.
Yes.
I have sustained 6 heart attacks because of this, and I'm not taking any medicines.
It's just inhaling and exhaling slowly.
Yes, proper inhale, proper exhale, do some pranayam, and I'm sure within 20 days you will get good results. Just do 1 hour and you will see, you will get what? Instant results.
I had practiced Kumbhak, I had practiced pranayam.
Kumbhak is different, madam. It does not give reductions into the brain. It does not reduce the adrenaline crisis. To reduce the adrenaline crisis, deep inhale from one nose, exhale from the other, stop. It is called along below, but in every action, it should be slow, pause, exhale.
And pranayam I had done from Art of Living. So
Art of Living, I was a teacher in Art of Living for a long time, then I gave up.
So I should do the same kind of pranayam, sir?
No, madam. It is one nose inhale, stop, exhale from the other nose, stop, and slow inhale, stop, close the nose, exhale from the other one, stop. From where you have exhaled, inhale again from there, stop, and exhale out. Practice it for 20-25 minutes. See your blood sugar after 1 month. It is almost 80% reduced.
So I should be doing this early in the morning or any time during
early
the day?
In the morning, 3 to 4 times a day.
3 to 4 times a day. Okay.
TDS. They call medicine as TDS. I also advise my patients to do this TDS. We have found in avascular necrosis and everything. It has worked wonderfully. Right now, one patient was having vomiting, vertigo, and everything. I advise him to do this pranayam for 5 minutes. Now the patient, the nurse just now came and asked me when the patient can have food. I said after 20 minutes he can have the food. But from afternoon now, he was suffering.
So there should be a 20-minute gap between your.
I just told him to have 20 minutes gap to see whether the symptoms are coming or he will vomit or not.
Okay, okay. And what about any tongue points?
हिंदी नहीं आती है
आपको?
देखिए मैंने उनको अनुलोम विलोम प्राणायाम के बारे में बताया था। एक पेशेंट आया था अभी जिसको वोमिटिंग हो रहा था, वोमिटिंग और चक्कर आ रहे थे, तो मैंने क्या किया, उसको बोला 15 मिनट अनुलोम विलोम करो और मैंने 2-3 पॉइंट यहाँ मार दिए, ठीक है। उसके बाद मैंने बोला 20 मिनट के बाद मैं आपसे आप खाना खा सकते हैं। मैंने नर्स को बोला फॉलो अप करें, तब नर्स फॉलो अप करके आई तो बोली सर वो खाना आप खा सकता है क्या? मैंने बोला आप 10 मिनट रुक के देखिए, वोमिटिंग टेंडेंसी, एसिडिटी कुछ हो रहा है? बोला नहीं अभी कुछ नहीं हो रहा है। मैंने उसको PC6 हार्ट से मैंने सब मार के आया था। नाउ पेशेंट इज टोटली स्टेबल एंड ही वाज एडवाइज्ड फॉर 22 million Indian currency यानी 20 lakh rupees for hip replacement, and we have reduced his pain to 90% as of now, without any medicines. No painkiller has been used in this case up to now.
और सर सिर्फ वो पॉइंट्स के बारे में जानना चाहती थी अगर
मैडम ये सब पॉइंट्स तो चलते जाएंगे, ये तो एक सिलसिला है।
ओके सर, थैंक यू सो मच।
अभी तो इंट्रोडक्टरी है मैडम।
अभी ये ट्राई करो
जब पॉइंट्स लिखाएंगे तो मैडम आपकी पूरी नोटबुक भर्ती हो जाएगी, क्यों चिंता करते?
ओके सर, थैंक यू सो मच।
तुम पॉइंट्स तो मेरे पेट में जमा पड़े हैं, सालों से जमा पड़े हैं, वो जब निकलेंगे तो निकलते जाएंगे, उसका कोई वो नहीं है।
Sure, sir. Thank you, sir. I'll be waiting for that also. But
We will
meanwhile,
give you all the
I'll try
protocols.
to-
Don't worry. और फिर बहुत कुछ मैं फेसबुक से भी बताऊंगा, वो वीडियोस भी पोस्ट करूंगा। Don't leave the group. और कोई अगर क्रिटिकल पेशेंट है तो डिस्कस भी करेंगे, समझेंगे भी, आपको भी समझाएंगे। आपसे नहीं हो स्पाइनल कॉर्ड इंजरी है सब, तो आप लोग रेफर करें, उसको कुछ हद तक रिकवर करके फिर आपको वापस कर देंगे पेशेंट, राइट?
ओके सर। लेटर कभी मेरे माँ के बारे में भी बात करना है, फिर कभी पूछूंगी।
करते रहिए, बातचीत चलती रहेगी, सिलसिला कहाँ खत्म होता है।
तो एक्चुअली वो अभी 3 महीने से एडमिटेड है हॉस्पिटल में, उनको सिवियर निमोनिया हो गया था। शी हैज रिकवर्ड फ्रॉम इट एंड देन फिर उनको हेमोग्लोबिन बहुत लो जा रहा था and then she was given blood. The problem is she is still with the catheter and using diapers. वो तो बाथरूम जाना चाहती है।
कोई खास बात नहीं, कैटेटर तो कोई खास बात नहीं है,
चल नहीं सकती।
कोई बात नहीं, we'll see क्या क्या करना है, we'll talk in detail.
थैंक यू।
कोई बात नहीं, मैं हूं ना। मुझे आज भी एक बात अच्छी लगती है, पी चिदम्बरम, former finance minister. Everyone was shouting, what will happen, what will do? Then he gave a beautiful reply. मैं हूं ना। I am there ना।
Not SRK. Thank you, sir. I'll be in touch for that, for my mother's day.
सुबह बात करेंगे, वेबिनार चल रहा है।
Any more questions? Chetty sahab? I have to go for my
Hello,
night
sir.
round.
Good evening.
See, my only problem is that I stay in the hospital and I'm 24 hours on duty. Right now, I have to go for my night rounds.
Oh my
So
God. Salute,
yeah,
sir.
this is only my
That's all
room.
for you.
And this is only my house and this is my only room. You can see.
Wow. House and hospital combined.
Yeah, my room is my house and I stay here for 24 hours.
Good, sir. Great actually. Sir, मुझे एक चीज पूछनी थी कि पेन मैनेजमेंट में TCM बेस्ट है, मास्टर टूम बेस्ट है क्या कंपैरिजन में, क्योंकि लॉन्ग टर्म के लिए which one
मैं
is
आपको
best?
एक जवाब दूं, आप बेस्ट है।
सर बताइए प्लीज।
You are the best person to judge which is best. There are many flowers in the garden. You have to select which flower you want to offer to God. As per the symptoms, as per the procedures, you have to select your methods, integrate, and there is nothing like this is best or this is best or surgery is best or that is best. As per the situation, you have to select the method and you have to take.
Sir, I have used this master tomb for pain, but after sometimes 1 or 2 days, the patient got back the pain.
See,
Not
can you
every
recover
patient,
pain in 1 day?
but some
1
patients.
minute without lifestyle correction, without nutritional correction, without anything, without muscle strengthening?
Not 100%, sir, but yeah, I can recover 70%.
This is acute pain
at least.
management. Tung is acute pain management. Thereafter, lot of things has to be done.
Okay.
One step is not the end of the journey. Walking
Right,
one
sir,
step
right,
is not
correct.
the end of the journey, right?
Correct, sir.
You are saying only after collecting one step, my journey is finished. If that is the way, then one painkiller should recover all the pain forever
Right, sir,
and
right.
finish.
Right. And one more thing, sir. Actually, I am also suffering pain or like both the epicondyle.
Nothing
That
to
is
worry.
radiating.
All the physiotherapists will suffer somewhere in the world. No need to worry. You put your TENS machine, ultrasound, you will You apply your own methods to recover and tell us, this method is better.
I want to try this one also.
Nah, you try. Your TENS machine is very good. I try every day.
Yes. I believe in that, sir. That is actually. But I want to
Anyway,
use this
any more questions?
needle also, na? Because I
Any
want
more
to give
questions? I have to
patients.
go for rounds. Any more questions? I have to go for rounds because one patient has to go
No,
for
sir. No.
catheter. Because there is one MND patient who is in the last stage. One is a Parkinson patient in the last stage. They are all about to tapak. Tapak means what? About to go to Jagjeevan Ram. That means they are
Sir,
about
I
to
will
go
ask you
to.
about Parkinson treatment also, because I am treating one patient.
See, what is your previous knowledge? How you are treating? I do not know. So I will share you some protocols, but how you
Sir,
are
I am
treating, what is the
treating with
methodology?
physiotherapy only.
Let's see, there are many ways in physiotherapy, what you are doing, coordination, exercise and all you are doing. I'm very happy with that. But my way of treatment is
Coordination,
non-invasive brain
cleansing, stretching,
stimulation,
range of motions,
nutritional
everything I'm doing.
correction,
Yeah, sir.
nutritional correction, non-invasive brain stimulation, stem cell therapy, many things are there. And you can see in my Facebook also, we have revived certain patients who are living still a healthy life.
Yeah,
Right?
I have seen that
Good-
video.
good night, sir.
Old education video. I have
Please,
seen that.
may I request you to skip me because patients are still having some panic. I am 24 hours on duty. In between that, I take 1 or 2 hours for the classroom. Because you refer,
Okay, sir.
you know who is my best examiner? You people, because you give me the most difficult case to recover. Who is my examiner? My students are the best examiner. They spoil the case and they give me to recover. So who is my examiner? You people. Every day you give me an exam to write, and every day I have to go with the most critical case to revive, sustain. And in this, you can see what has condition has become of mine. Anyway, all of you, thank you so much.
Thank you.
Good night, sir.
Thank you.
Dr.
Good night. Sayonara.
Good night,
Thank
sir.
you.
Thank you, sir. Good night.
Thank you, sir.
Good night.
Night.
Thank you,
Good
sir.
night.
Thank you, sir.
Good night, everyone.